External oblique muscle arises as 8 fleshy slips from outer surface and lower border of lower 8 ribs. Upper 4 slips interdigitate with serratus anterior and lower 4 slips interdigitate with latissimus dorsi. The most posterior fibers pass vertically downwards and inserted on anterior half of outer lip of ventral segment of iliac crest. The rest of the fibers pass downwards, forwards and medially and end on an aponeurosis. The aponeurosis resembles an italic F-shaped line where the upper part of the F follows the costal margin and lower part of the F extends from tip of the ninth costal cartilage to just in front of the anterior superior iliac spine. Then the aponeurosis extends medially and ends on linea alba. Linea alba is a thick fibrous band which extends from xiphoid process to symphysis pubis. Medially, external oblique aponeurosis is limited by linea alba. Lateral margin of external oblique is free and it forms lateral boundary of lumbar triangle of Petit. Upper margin of external oblique aponeurosis is horizontal and it is overlapped by pectoralis major muscle. Lower margin of external oblique aponeurosis is thickened and folded backwards to form inguinal ligament, which extends from anterior superior iliac spine to pubic tubercle. Then, what is inguinal ligament? Lower margin of external oblique aponeurosis is thickened and folded backward to form inguinal ligament. Laterally, the inguinal ligament is attached with anterior superior iliac spine. Medially, the inguinal ligament is attached with pubic tubercle. So, the inguinal ligament extends from anterior superior iliac spine to pubic tubercle. It is 12 to 14 cm in length. Medial end of inguinal ligament presents 3 expansions. A triangular expansions which directed backwards and upwards and posteriorly attached with medial part of pecten pubis is called lacunar ligament or Gimbarnet's ligament. Apex of lacunar ligament lies medially and base is concave and lies laterally. Another expansion is pectineal ligament of Cooper, which extends from base of the lacunar ligament to iliopubic eminence. The third expansion is reflected part of inguinal ligament, which extend upward and medially from the most medial part of the posterior margin of inguinal ligament. It passes in front of the conjoint tendon and attached with the linea alba, where it interlaces with opposite similar fiber. A triangular gap presents just above the pubic crest on external oblique aponeurosis. This is called superficial inguinal ring. Contents from the inguinal canal exits through this gap or opening. Measurement of superficial inguinal ring: apex to base 2.5 cm and at the base 1.25 cm. Base of the superficial inguinal ring is formed or limited by pubic crest. Apex is directed above. It is formed by meeting point of superior and inferior crus. Superior crus medially attached with symphysis pubis and inferior crus attached laterally with pubic tubercle. Anterior margin of inguinal ligament is continuous with external oblique aponeurosis. Posterior margin of inguinal ligament on its medial part presents 3 expansions: lacunar or Gimbarnet's ligament, reflected part of inguinal ligament, and pectineal ligament of Cooper. Lateral to base of lacunar ligament, the posterior margin of inguinal ligament gives attachment anteriorly with fascia transversalis and posteriorly with fascia iliaca. Opposite femoral ring, the fascia transversalis and fascia iliaca enter into thigh as anterior and posterior sheath of femoral ring. Undersurface of inguinal ligament gives attachment with fascia lata, which is deep fascia of thigh. Upper surface of inguinal ligament is grooved upward. What is the boundary of inguinal canal? This is inguinal canal, which is a musculo-aponeurotic tunnel which extends from deep inguinal ring to superficial inguinal ring. Deep inguinal ring is an oval opening in the fascia transversalis. This is fascia transversalis. Deep inguinal ring lies 1.25 cm above the midpoint of inguinal ligament. Superficial inguinal ring is a triangular gap on the external oblique aponeurosis which is situated just above the pubic crest. Anterior wall of inguinal canal, lateral one-third is formed by internal oblique muscle and its whole part is formed by external oblique aponeurosis. Posterior wall of inguinal canal, medial one-fourth is formed by reflected part of inguinal ligament, medial half is formed by conjoint tendon which lies behind the reflected part of inguinal ligament, and whole part is formed by fascia transversalis which lies behind the conjoint tendon. Roof of inguinal canal is formed by arched fiber of internal oblique and transversus abdominis. Most medial part of the floor of inguinal canal is formed by lacunar or Guimard's ligament and laterally formed by upper grooved surface of inguinal ligament. I think this is the most advanced diagram of the inguinal canal, and I spent 30 days to draw this diagram.